we go. Let's talk about the thyroid. All right, where's the thyroid located? Right here. Does it do the same thing as the parathyroid? Absolutely not. What's the main job of the thyroid? Oh, that was asking too much. It does produce that, but what's its job? Like parathyroid hormone's job is to balance calcium and phosphorus. How does it do that? Through PTH. See what I mean? So what's the thyroid's job? Oh, cool. It's not on your paper, so what are you going to do? Oh, no. There is a thyroid hormone. Interesting. That's the ways the hormones that it's producing are the ways that it does its function, right? So we need to get to the root of the function. No one? Have I stressed you out enough? Can I tell you now? Okay, so the thyroid's job is, and I'm going to be careful when I say this, it is metabolism, but not like breaking things down and not like, oh, I eat and I stay thin. It's not like that. It's metabolism, which means the get up and go of all of your organs. It tells your organs in the morning time, get up and do your job. Okay, so that is very important to know because what happens when you have hypothyroidism? Do your organs get up in the morning? So what happens when you have hyperthyroidism? All your organs are like, ah. Okay, now do we understand? All right, so let's look at this. Don't get overwhelmed by it. Just don't panic. Okay, so what this says at the top, the stimulus, this basically gives you the pathway that the thyroid hormone is secreted. I already talked to you guys about this, and it's on this page. Okay, so don't worry about that. You understand what I'm saying? Okay. So what is the job basically of what we know what the thyroid does? Yes. Okay. And then these will tell you other things that the thyroid hormones do in more detail. So they increase your metabolic rate. So they help your metabolism like, let's go, right? They increase your glucose uptake. What does that mean? More energy. Puts more sugar inside the cells and gives you more energy. Okay. It increases glycogenolysis. Oh my God. What does glyco mean? It's glucose or glucose or sugar. Okay. What does lysis mean? Oh, gen. What does gen mean? Like to generate, to make. Good. And what does lysis mean? To kill, right? So it is killing the making of new sugar. Okay. And gluconeogenesis, which gluco means sugar. Neo means new. Genesis means to make. So it makes its own new sugar if it needs to. Okay. So that means like, oh, hey, organs, it's morning time. I'm going to feed you some sugar and then let's get up and go and do what we're supposed to do today. Does that make sense? Okay. Okay. Increased lipolysis. What does lipo mean? Like fats. Yeah. What does lysis mean? To kill. So it helps to kill your fats, and y'all know you can use fat also for energy. Yes. Decreased lipogenesis. What did lipo mean? Fat. What does genesis mean? Right. We don't need to make more fat cells because we're telling you to get up and go, right? Increases your breathing rate, increases your heart rate, right? It tells your organs, get up, let's go. Does that make sense? Yeah. Okay. So let's go on our hypo versus hyperthyroidism. Okay. All right. So your word for thyroid is get up. But it says hypothyroidism. You are not getting up. So everything's going to be asleep and slow, right? All right. Biggest causes, it does tend to run in families. Okay. Pregnancy can also put you in a hypothyroid state because it is asking a lot more of you and you don't have the metabolism to do that. Just getting older can do it because your thyroid, it ages over time, right? Y'all know you need iodine in order to make healthy T3 and T4. So if you have an iodine deficiency, then you can't make your thyroid hormones. There is an autoimmune form of hypothyroidism. This is often on exams. It is called Hashimoto's. So Hashimoto's hypothyroidism means you have hypothyroidism caused by an autoimmune disorder. But you can have just hypothyroidism without it being an immune disorder. You can have familial hypothyroidism or something like that. You can have something called thyroiditis. Anytime you see itis, what does that mean? Inflammation. So there could be an inflammation of your thyroid causing it not to do what it's supposed to do. And then there's also something called congenital hypothyroidism. When you see congenital, what does that mean? You're born with it. Doesn't mean it's genetic. Genetic is different. Genetic means it's on your DNA. Congenital just means I was born with this disease, already in process. And when it's congenital hypothyroidism, they call it cretinism. So if you see that word on an exam, it just means a baby that has hypothyroidism that was born with it.
But how is that possible? We would be born with it.
Because usually mom was hypothyroid, and so if she didn't pass on thyroid hormones to baby can't make their own thyroid hormones. So if mom was hypothyroid, baby's probably hypothyroid. Or if mom was hyperthyroid and she had to take medicines to decrease, and that crosses to the baby had normal thyroid hormones, but it got the medicine that decreased it. Yeah. All right. So signs and symptoms. We have acronyms for this. So she's slowed down. Okay. All right. So they are very sensitive to cold because they can't like warm up to or shake to warm up. Okay. They have a very hoarse voice because even like this ain't waking up. You know how you wake up first thing in the morning, your voice sounds like this. Okay. They have excessively thinning hair because you got to think anything that's on the peripherals is not, it's going to get the worst of it because it's going to give like blood supply and like it's get up and go like from here kind of out. So like your nails are going to be really thin and brittle. Your hair is going to kind of fall out and get really thin. What happens to your brain, you think? You're going to be kind of just slow and groggy. You've ever felt like just like cloudy headed and can't remember anything, right? Heart rate? Low. So they have, what's that called when you have low heart rate? Bradycardia. Okay, and that would be a heart rate less than 60. Good, 60. Yes. Your heart rate and your blood sugar should be the same. So heart rate 60 to 100, blood sugar 60 to 100. Easy enough. All right. Sexual dysfunction. If everything is super slow, are you going to feel like all hot and heavy and feel like really putting it down on someone? No, I'm going to be like, oh my God, I haven't pooped in like 10 days. I'm super fat. I do not feel like getting sexy with you. Okay. So that's why they have a very low libido. Remember their hair and nails, very dry, very brittle. Muscles are just weak. Why would they have elevated cholesterol? Whose job is it to get rid of cholesterol? Which organ?
Liver?
Yes. Anytime I ask you an organ and you don't know, you can probably guess the liver and be right about 70% of the time. So the liver's job is to not only make cholesterol, but it also gets rid of cholesterol. Well, you forgot to tell the liver to wake up this morning, right? Okay. So it's not going to be able to get rid of your cholesterol. Now, whenever everything's slow and blah, 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 of course, you're going to feel depressed. Your skin's going to be really dry. You're going to get really fat, right? Overweight, weight gain, and severe constipation. Like you ain't never pooping. Because your gut is like, I did not get up this morning. Do we understand? Yeah. Okay. In this case, remember I told you the hypo will always match something. It matches the T3 and T4 in this case. So when you have hypothyroidism, then your T3 and T4 are your actual thyroid hormones, right? All right. So if you have hypothyroidism, then your T3 and T4 are going to be low. Your TSH will always be opposite because your TSH stands for thyroid stimulating hormone. So when your T3 and T4 go low, it's the one that's like, girl, get up. We got to exercise today. Come on. So it's going to increase. Do we understand that? All right. So your treatments, there is a drug called levothyroxine. This is like 1,000,000% testable. Okay. I don't know why, but every nursing school, every ATI, every HESI, every NCLEX loves this drug. Okay. So levothyroxine is the name of the drug, and they will need to be on lifelong treatment because that thyroid never is going to just be like, hey, let's get up this morning and do something. Okay. Now, the worst case scenario of hypothyroidism is where you go into a severe hypothyroidism where you're making no thyroid hormones. Now, what do you think your body is like at that point? You're just laying there, right? It is called a myxedema coma. Okay. So what do you think your heart rate's going to be at this point? 1. Okay. Your respiratory rate, very low. Blood pressure, very low. Temperature. You're in hypothermia, okay? So we need to treat this very aggressively because your respiratory rate's like 4, okay? Your blood pressure, super low. Your heart rate's like 30. Like you're going to die, right? So we will give levothyroxine IV immediately. We're going to do warming measures. What can you do to warm up a patient? Warming blankets. We can do warm IV fluid, just like before. Didn't we talk about cooling measures? Yeah, okay. So we'll do like warm IV fluids. We'll turn up the temperature in the room a little bit, right? Now they also get very low blood sugar. I will tell you all this, and this is very important. For all of nursing school, this will always and forever be your priority. Hypoglycemia can kill you in 10 minutes.
Oh.
Hyperglycemia can kill you in about 40 years. There are people that have had diabetes out there for 20, 30 years and have no idea. It has not killed them. Hypoglycemia will kill you in no time. So hypoglycemia will always be a priority, and don't let them trick you. Even if they say like, oh, their blood sugar is 600. Cool, moving on. It can't kill them. Okay. Now they can die from acidosis produced by the high blood sugar, but that would take a very long time. Do we understand? So we need to correct their hypoglycemia because if everything's really slow, their pancreas and their liver didn't get up either. So their blood sugar may be 40. I've got 10 minutes till that patient dies. How do we fix the hypoglycemia? Yes. Here is 4 ounces of orange juice, or you can give them candy or like something that has a very quick sugar. Okay. We need to give them massive IV fluids because how come? Their blood pressure is very low. It's probably like, y'all know what the minimum blood pressure is where you have to do something? Does anybody know? I'm not expecting y'all to know anything. 90/60. Anything less than 90/60, they're at risk of going into shock. Okay, so we would have to treat that with IV fluids aggressively. Why am I doing an EKG on this patient? What's their heart rate? You're like 1. Yeah, their heart's probably about to stop. So we probably had to do that. We're going to do an hourly urine output to make sure that their kidneys are not dying. Okay, because y'all know shock means that your kidneys are getting so little fluid that they die. Okay. Does anybody know what a vasopressor is? What does vaso mean? A blood vessel. And what does to press mean? Squeeze. So what do vasopressors do? Squeeze your vessels to increase your blood pressure. Give me a vasopressor that you should already know because we talked about it today. What kind of hormone could you give that would squeeze somebody's vessel? It's a vasoconstrictor. We've talked about several of them. Norepinephrine is a good one. We can actually give that as a drip in an ICU. Doesn't epinephrine vasoconstrict too? Yes. You know, when people's heart stop, that's what we give them is epinephrine to squeeze their vessels enough to give us any kind of blood pressure. Didn't we also say that ADH was a vasoconstrictor? Yes. So we can give, there's a synthetic form of ADH. It's got a crazy name. It's called vasopressin. Guess what it does? Presses their vessels. Okay. They may also call it desmopressin just in case. It's the same thing. It's just a different brand name. Okay. And then obviously we need to watch their airway because their respiratory rate's probably like 4. So probably ought to do something. Yeah. And that's just in a myxedema coma. They don't always live like that. That's if they get into like worse and their face gets like really swollen and they're just like laying there. Okay. But for everybody else that just has hypothyroidism that is not in a myxedema coma, okay, we need to watch their heart rate. You will actually teach patients to take their apical heart rate and do it at home. So that way they can tell how well their disease is going and how well the levothyroxine is kind of working. Okay. Here's our friend FFM. What are we increasing FFM for? Fluids, fiber, mobility. They're very constipated. They're not pooping. We're going to put them on a low-fat, low-cholesterol diet. Why would I do that?
Because low-fat, because your liver can't
break down the cholesterol. That's right. So, and they're very overweight, remember, because everything is slowed down and they don't have enough metabolism. So we need to decrease that in their diet. Small, frequent meals. Let me tell you this. There is never a time in nursing school you will not pick this in a select all apply. Because when is there ever a time you're going to tell a patient, eat one big giant ass meal a day? Like you wouldn't do it. Small frequent meals are great for everybody, right? All right. Do we understand hypothyroidism? All right. Let's go to. Oh, yes. Yeah, sure.
Can I clarify what IVs again for?
Which part?
IVs for mastodina.
Oh, because remember, everything is slowed. Their blood pressure is really low. The first thing you always do for low blood pressure is fluids, because more fluid.
More pressure.
Yes. Okay.
That's just IVs, right? IVs.
Yes, IVFs is IV fluids.
Oh.
So anytime you see IVF, it's not in vitro fertilization. It is, we will not impregnate this person. They're busy right now. It's IV fluids. Okay. All right. Do we understand hypothyroidism? All right. Now, what would hyperthyroidism look like? So this can also be familial. There is an autoimmune form that is called Graves' disease. Okay. What was the autoimmune of hypothyroidism? Hashimoto. You said it so nice. And then hyperthyroidism is Graves' disease. Everything is sped up so much they go into a grave early. Okay. I used to not say that because, well, I said it for a long time. And then one of the girls, as soon as I said that, she goes, my mom has hyperthyroid. And I was like, sorry, but I brought it back anyway. All right. Thyroiditis, we already talked about. And then I told you TUMA, right? TUMA or TWAMA. All right. So we've got an acronym for this one. It's She's on the Speed. Okay. So they are super sweaty because they're moving around all the time and they're very, very hungry, but they're eating all this food and they're still staying very, very, very skinny. Okay. You ever seen like a little old grandma who like she smokes too much and she drinks too much coffee and she's like super skinny and she's always like, oh, let me take them grandkids. Y'all know what I mean? That's what I picture when it's hyperthyroid because they're very hungry. Their eyes like bug out a little bit. It's called exophthalmos. Yes. Their eyes like, because they're like moving around all the time and they seem like they have ADHD and they're just going to be like, oh, hey, when I haven't slept in 3 days. I don't even know. I'm going to go vacuum. Okay. They get short of breath with some very crazy odd mood swings. They're very, very nervous and they're moving around all the time. They got tachycardia, right? They look hyperactive. Excess temp. Their temperature's really high because they're constantly moving around and they've got all this heat, right? You think they sleep? No. So their eyes are all puffy and they're getting these crazy palpitations and their thyroid is like big and giant. That's called when your thyroid's real big. Starts with the G. I hate this word. It's so gross.
Hold up.
Okay.
Goiter?
Yes. It came out of nowhere. Goiter. It's called a goiter. 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 They will have excess weight loss. They're super, super skinny, right? And their gut is like, so they're going to have massive diarrhea and it's going to go so fast, they're going to get dysrhythmias. Yes. All right. So the hyper is going to match the T3 and T4. So they're going to have high T3, T4. Remember, TSH is opposite. Because if you already have really high thyroid hormones, your TSH is like, I ain't going to stimulate you no more. You a little crazy there, granny. All right. There is a drug for this as well. It is called PTU. The reason we call it PTU is because its actual name is propylthiouracil, and ain't nobody got time for that. So it's pretty much across the board labeled PTU. Okay. Now, I did put this in here because this is probably one of the most testable fun facts I've ever seen in all nursing schools, is that this drug PTU causes a side effect called agranulocytosis. What are granulocytes? White blood cells. And what does A mean? Without. So what is this patient at risk for? Infection. So PTU is a medicine that we give to slow down the thyroid, but it does cause agranulocytosis. So that patient needs to report signs of infection like sore throat and fever if they're on PTU. Does that make sense? Yeah. Okay. What do beta blockers do? They sure do. Those beta cells, you know. So beta blockers do two main things. We'll do this more in farm later, but they decrease the heart rate and they decrease blood pressure, which this patient pretty desperately needs. Okay. And if all else fails and this thyroid is acting real bad, what do? Yank it out. Thyroidectomy. Okay. Now, just like there was a severe form of hypothyroidism that was called myxedema coma, there is a severe form of hyperthyroidism called either thyroid storm, they may call it thyroid crisis, or thyrotoxicosis. All three of those names mean the same thing. Now, in that case, what's happening to their heart rate? It's going so far, okay, and their right, and their blood pressure high, and their temperature high, and their gut is like they're just continuously pooping themselves. Okay, so we probably ought to settle this down. Okay. So we're going to give them PTU, IV, stat. That's the drug that's going to decrease their thyroid, right? Then we're going to do cooling measures like cooling blanket, cool IV fluids, ice in the axillary and groin. Their muscles get like, so we have to give them muscle relaxers. Okay. We're going to give them some acetaminophen because their temperature is probably like 106, right? And then we're going to sedate the crap out of them because can you imagine how they're acting? You know, we're just like, until this gets better. All right. If they're not in thyroid storm, but they just have hyperthyroidism, obviously we need to watch their heart rate, their temperature, their electrolytes because they're having a lot of diarrhea, right? Their diet, they're going to need a massively high calorie diet because they're losing so many calories by running around in circles, right? Why would they need high protein? Build muscle back. Why would they need high carb? That's sugar. They need immediate, yes, energy. They need immediate energy. We're going to do a daily weight. How come? Yes, because they're losing weight. They usually lose weight. They're very, very thin. We want to see if they are putting on weight. But remember, this is very important for all of nursing school. The best indicator of fluid balance in a patient is a daily weight. You will never pick eyes and nose. Doesn't mean that those, you won't pick them in some weird select all that apply. But if they ask you what is the best way to determine a patient's fluid balance, it is not blood pressure. It is not eyes and nose. It is a weight. Okay. Because we can see how much fluid they're retaining. If I weighed you today and then I weighed you tomorrow and there's a 20-pound difference, is there any way you could have increased your fat by 20 pounds? There's no way. That is 20 pounds of fluid. And then I'm going to give them Lasix or furosemide, and then I weigh you again and you're 20 pounds down. You just lost 20 pounds of fluid. You see what I mean? Okay. All right. Low stimulation environment is probably helpful. And plan rest periods. Now, maybe very short ones. These patients, they're not going to be able to sleep 8 hours at nighttime. But your first goal for them may be to take a 30-minute nap or to sleep for 4 hours tonight, something like that. Do we understand hypo versus hyperthyroidism?
Quick question. So
Sure.
You said those patients report sore throat and what?
Fever, sore throat and fever. Those are signs of infection, right? Which would tell me that, hey, they probably have agranulocytosis.
Okay, very interesting. And why did you allow this talk about tumor trauma?
Tumor or trauma, usually almost all these endocrine disorders happen from that. Because if you have a brain tumor that's pushing on your hypothalamus, guess where all these hormones are releasing from? The hypothalamus. So if you have a brain tumor, that's pretty much where most of these are coming from. Or if there's brain trauma. So if you get hit in the head in some kind of way, get in a motor vehicle accident, and there's swelling of the brain, it can compress the hypothalamus, causing these endocrine disorders. Does that make sense? Okay. All right, questions on the thyroid?